Today we're going to be talking about using a sensory trick, and the patients who use this sensory trick are usually trying to relieve some type of dystonia. So the dystonias that come to ophthalmology are not like the cervical and body dystonias, they're facial dystonias. And so the facial dystonias that we see are when the lids are spasming, and that's blepharo. So we have benign essential blepharospasm, which is bilateral blinking of the eyes. It looks like this. And if it goes into your face, we call that the Mej syndrome when it's involving your face. But they're basically the same type of dystonia. And when it's one side, we call that hemi. And if it's in your face, hemifacial spasm. So hemifacial spasm looks like this. It's just one side. So hemifacial is unilateral, benign essential blepharospasm, and Mej syndrome are bilateral facial dystonias, lid, whole face. So these conditions are usually benign. We don't normally image blepharospasm, but if it's hemifacial spasm, we're going to do an MRI and an MRA to look at the seventh nerve. And usually there's no lesion, but sometimes there's a cerebellopontine lesion causing the seventh nerve to be firing. The most common structural lesion that we find is a dolichoectatic, a dilated and tortuous vessel in the posterior fossa, usually a branch of the vertebral system, like the cerebellar arteries, like ICA. And in blepharospasm, you can do an MRI, but usually it's normal. So the sensory trick is a way that patients are able to suppress the firing, and so they can be touching their lid or touching their face or stroking their eyebrow or touching their chin. It's a sensory thing. So they're using a sensory trick to somehow modulate the sensory motor balance. It's not really clear how this works, but a lot of patients have this sensory trick. They can also use forcible motion that's voluntary, so they can either lift up their lid like this to keep it from closing, or they might press it down or press real hard. And the reason that's important is if we can identify the sensory trick, we can sometimes use a device to mimic the trick so they don't have to keep going like this all the time. And so in patients who have spectacles, we can mount something onto the spectacle to press on their forehead and press right on the place where they're already pressing. And so if in the lid examples, we have ptosis crutch, where it can just hold the lid up like this. And there are devices, including the press-up device, that can be used to press on your temple or wherever. It can be modulated to move to wherever the sensory trick is being generated. Interestingly, some patients have a sensory trick that does not require physical contact. They can just imagine doing it. So just imagining themselves doing the sensory trick can make the dystonia less. So you need to know about the sensory trick. It's a symptom that sounds crazy but isn't. I can touch my eye or lid or rub my face here and it makes my jumping of my face less. That sounds like a crazy thing, but it's absolutely real. And we want to try and image hemifacial spasm. You don't have to image benign essential blepharospasm. They're facial dystonias, and we can use the sensory trick to our advantage by using devices that can mimic the sensory trick. And of course, the mainstay of treatment for all of these spasm conditions is botulinum toxin.